Well, good morning or afternoon, MRHA listeners. Welcome back to the Voice of World Health podcast here today. I have on a special guest again, Mr. Eric Sullivan, with a company called, an app called Unio Health, and I will turn it over to him to introduce himself.
Oh, hey, thanks, Jonathan, and thank you for your time speaking with you and addressing the MRHA community. So, yeah, a little bit about myself. I grew up in Maryland and in the suburbs of Annapolis area. We have two kids, and my wife is actually a high school guidance counselor, which is incredibly relevant for why we're here today. And I've been basically, I started, my career about 30 years ago on the healthcare delivery side at Anne Arundel Medical Center and some other hospitals, and spent 30 years in the health tech sector. I was a vice president at Care First for innovation and United Healthcare, a similar role as national director for primary care innovation. And that kind of just built my career of really focusing on how to leverage data and technology and clinical goals, business goals, ultimately, and try to problem solve them with new technologies. In my last 10 years, Jonathan, I've spent at a company that was headquartered in Bowie, Maryland, called Inovalon, that really focused on healthcare quality and risk adjustment alerts and gap closure for the health plan and health system sector. So I spent 10 years doing that. It's kind of brought me to my current endeavor, which we can hit on, but that's kind of been my pathway.
Great. Thank you for giving us that overview of yourself. Can you tell us a little bit more about that move to Unio and, why a career change now?
Yeah. No, so I've been that prior company for about 10 years and, enjoy the challenges of working with health plans and health systems on new technologies to help them address, get what they call gaps in care and addressing things like compliance around pharmaceuticals and those types of approaches. But last fall I left there, and of course my family said, asked me, what are you going to do now? And having spent 3 decades in healthcare, and that specifically on the technology side, and what I realized was the one area that I always struggled with, and frankly the entire healthcare ecosystem struggles with, is that that final mile, that actually engaging the consumer effectively. And my wife would share with me the challenges of the high school and that she has worked at for a long time. She's actually now at the middle school in southern Anne Arundel County, and just the struggles of engaging the youth on their own health, on their own situation, and letters and phone calls don't really work. I just realized that with everything going on with kind of as we kind of wind out a little bit out of COVID, with the increase of mental health issues with youth. When I say youth, I really mean kind of teens to 20-year-olds, the most often called Gen Z. But there's a big struggle with engaging them. Now more than ever, with the increase of mental health and depression, 1 in 3 have feelings of loneliness and sadness. And if you're youth under 30, 1 in 5 have prediabetes, and if you're Hispanic or African American, it's 1 in 4. And these numbers aren't getting better, and yet the healthcare system is still trying to engage them with the traditional routes for the most part, which is either portals or letters and phone calls. So I just really wanted to focus on that. And I'm on the board for the American Diabetes Association in Mid-Atlantic, and really wanted to see how we could tackle both prediabetes and kind of the related comorbidities of anxiety and self-esteem and other areas that are impacting Gen Z. And I built a team in the beginning of this year, 2022, of college and high school students, University of Maryland students, building an app. So our goal was to build a free app for Gen Z. We brought on 7 students at UCLA through one of my contacts to help us focus on the right, healthcare content that would be in the app, the right approach to addressing, this type of population that struggles. And really, some of the people working on the app are in their late 20s, so they're millennials, and they have all the same issues. They just don't use mail or email, frankly, and certainly not being able to answer phone calls. So there's just a large need to figure how can we be more creative and engaging the consumers. That really spawned, kind of spurred the growth of Unio, and we launched an app just this week. Kind of after Q3, we focused on testing it, but the app is called Prosper, and our goal really is to just get this into the community, get it into the hands of Gen Zers, and really help them navigate the system as well as self-care. That's kind of why this, and kind of what what I'm hoping to accomplish.
Yeah, absolutely. And, I can say, being from Generation Z myself, that, engagement with individuals within, that generational population can be challenging, especially with traditional methods of mail and even email. Sometimes, messages can be lost. So engaging them where they're at, and most oftentimes they are on their, cellular devices using those applications. And so I applaud you for that. You mentioned a little bit about, the goals of the Prosper app. Can you go a little bit more in depth there?
Yeah, I mean, I think it really is kind of we're trying to solve for a dual challenge, right? And there's tens of thousands of healthcare apps out there, and but they're often either singularly focused on a condition, or they're your traditional healthcare care management apps, which just do not resonate. We surveyed hundreds of kids this year. I say kids, I'm anyone under 30 is a kid to me, frankly. Sorry, but those type of traditional care management apps don't work. And so our goal was to create really a free gamified app that kind of took the theme of consumer centric or patient centric, which has been around now for 15 years, and really focus in on that. And so our goal was to get as much feedback as we could. So we surveyed and interviewed just a tremendous number of high schoolers and people in their 20s, as well as Johns Hopkins Healthcare, their diabetes center. We had several other patients that are focused on diabetes prevention in our user group, and just really wanted to understand what are the things that they struggle with. And what we learned, Jonathan, is time management, organizing your day. My son, who's the co-founder, who's a computer science major, that generation, your generation, what we heard from all these engagements was, that you're living in a moment often, especially when you're in high school and or in college age, and you're just flying by the seat of your pants and just trying to get through the day. So helping them organize around that, kind of set some goals or habits, if you will, within a structure that is interesting and gamified, has the ability to personalize that app. Is that whole side of this, which is adoption, is key. So that's kind of one half of the equation. The other half is really my background, which is working with health plans and health systems for the last few decades, which is there's so many resources out there, and I certainly understand that there are still a challenge of getting more resources, and there's a shortage of different mental health providers, et cetera. But there are a tremendous number of resources. There's over 40,000 healthcare nonprofits, and and yet those resources often don't reach the consumer. It's not for lack of trying. It's just the consumer, if you're trying to reach someone who's 28 and you're sending letters about a new program, good luck, right? Or make a phone call, or ask them to go to a portal. That just doesn't work. So the other side of this equation was, with my background on the health plan, health system side, is can we find a way to bring that constituency into the fabric of the Gen Z, or the younger user? So can we bring them into and create a community inside this app, Prosper, where they can communicate with their patients or their members, their clinic patients, on their programs or services. Maybe there's a new community-based organization that they're partnering with to provide transportation or a food pantry, things like that. Can we bring them into this consumer-centric experience, as opposed to trying to pull this population into their world, which is, frankly, my experience says it just doesn't work. So that really is the two sides of this equation, which is build a a simple, engaging app that's got a lot of important, aspects to it of self-care and wellness, but at the same time, link the consumer kind of through a personalized algorithm to different resources they need, and invite them to a community for their local, health clinic, where when they subscribe to that community, every time the community wants to share a resource, it automatically lands in their app as a notification. Like, to me, that's so much simpler. So that's kind of, our goal was really to solve both sides of that equation through a simple, bridge, if you will, digital bridge.
Great, thank you. And that's definitely a challenge. And it seems like that your app, really does solve those challenges. And with that, I think it's a great segue over into, can you go a little bit more in depth as to, how the app actually works?
Yeah. I mean, it starts with the consumer, frankly, right? There's it's going to be in the App Store starting next week, which should be the week of, what would next week be? The week of the 7th, November 7th. And, right now we've got it launched with our user groups to just go through and continue testing, but it's a very simple experience for the consumer to obviously download it, and it's got all the security and data privacy, considerations very, very much, shared and present, because that's also another blocker for engaging those that are, in their 20s, et cetera, is just, what are you gonna do with my data? So I think, we address that on the onboarding. They pick their journey. So we have, I think, 6 or 7 journeys around, if you want to focus on just general well-being, or is it self-esteem, or is it prediabetes, or is it anxiety? So that helps us start curating our content, right? And then we ask them, and this is very common for apps, certainly geared to those who are kind of under 40, I guess, but what are their interests? Is it music? Is it art? Is it exercise? And so when they start and they land on a homepage, they're prompted to start taking action on their own self-care. So they're prompted to do a check-in every day on their health, which is really, it seems very basic, but it's really important, is to check in and say, this is how I'm feeling. They can journal about it. And then when they get points, and they get kind of encouragement along the way to do those tasks, and they are prompted with recommended content. We have over, I believe it's now close to 500 curated YouTube TED Talk videos. About a third of them are coming directly from national organizations like the American Diabetes Association or CDC and others, but they're engaging videos, right? This population is not going to read static PDFs and content. So share messaging and help educate them on their own self-care through that, and through activities in the app, like mindfulness activities. And then they're prompted to explore the community. So right now we have the Prosper community, but our first sign partner is in NAMI, the National Alliance on Mental Illness in Maryland, where they can join that community. And basically it's a simple click a button to subscribe. And now every time NAMI wants to share any of the new programs and events that they're having or resources, they're right there. And if they're looking for resources, we have a partner, findhelp.org or .com, that is basically they have thousands of resources across Maryland that if you're looking for transportation or housing, food and security issues, things that relate to social determinants of health, those resources are right there and are super easy to navigate. So it's kind of that holistic experience of personalized recommendations, communities that could be of interest to them. It could be of the local clinic that has invited them to, or maybe incentivizes their population to join. And so then now they're connected to their healthcare provider or their health plan. So that's kind of how it works on the customer side for Prosper, meaning the health plan, the health system, the nonprofit. It's really a matter of them setting up their group inside the app, and I can walk through it later. But it's a really easy way for them to basically set up their own part of that community for that user, and basically be able to share all the resources. So that's kind of how it works. It's we really focus on keeping everything simple, very much personalized, and with some gamification, frankly, points and badges and things like that actually encourage you to keep going, right? Check in every day and keep adding more points and making more progress.
Great. Thank you for giving us that wonderful overview. And, another good question here would be, so our organization, of course, the listeners here at MRHA are made up of not only individuals, but health departments, hospitals, and clinics. And how can this app really be of value to them?
Yeah, no, it's interesting. When you and I first talked, a couple months ago, I knew that there was a lot of issues, and there's so much focus, frankly, in the press and otherwise on urban population struggles and in the cities and all that. But I didn't realize that 1 in 4 Marylanders, or I think it's 1 in 4, live in rural communities, and I've certainly been through the whole state many times, but didn't realize just that it's that many people that are in those communities. But the struggles are the same in a lot of ways. And I looked at the I think it was your 2018 priorities or 2019 report, and the issues around access, recruitment, the healthcare challenges and struggles that your members deal with, whether it's addictions and opioid abuse or use, ER and inpatient visits that really didn't need to happen, but because of lack of access, awareness, connectivity, they do. And certainly the converse of that is promoting more primary care and even telehealth. To me, those struggles they're really the same across the U.S., whether it's rural or urban. And I look at those goals that your community has. I feel like that we can really play a simple role there, right? Which is to help them with the recruitment, help them share their resources, whether they're community-based resources or clinic resources, health department resources. We're talking to a couple health departments right now, because that just that awareness is so important. Hey, if you're in need of this, this clinic, or you're in need of this type of transportation, or there's a wellness session tomorrow night on Main Street at 7:00. Like, how do you get that outside of mailers and emails? So I think that we could really help the just as well with the urban focus, really help on the rural setting, close that access challenge. And one thing I wanted to mention, I think I told you this before, we built this app so there's actually a web version as well, because sometimes if you're living in, I rode my bike all through Cumberland and way out there, and a lot of times you don't have good cell access. And so folks often are going, and I'm preaching to the choir, but they may go to the library to go online. And so we actually have a web version of this app as well to support that kind of digital equity issue that certainly exists in the rural setting.
Great, thank you. That's all great and fantastic, information for our listeners. And, a lot of our priorities, and you were right when you mentioned that, 1 in 4 Marylanders do live in rural communities. I just looked at the census not too long ago and did some calculations myself. I believe it's about 1.8 million Marylanders now live in state designated rural areas.
Yeah.
And before we let you go, Eric, is there anything that you want our partners to know about the work that you're doing, if they want to become, an early adopter or look at the pilot that you have, that would be beneficial to them?
Yeah, definitely. No, great questions. So I think that, one is, it ultimately comes down to, everything comes down to an ROI and, what is the value prop here? I think our value prop is really straightforward, right? If you can increase engagement, increase awareness, can you ultimately make your members, your patients more sticky? Can you drive down the avoidable spend in an efficient way? We're looking right now, we have a couple pilots lined up. I mentioned, NAMI, and we have some other partners that we'll be announcing that are on the healthcare delivery side. We have a telehealth partner that you can access right through the app. I think if folks are interested in learning more, they certainly can send me an email, which I assume that you would have on the podcast, but it's eric@uneohealth.com, and check out our website, uneohealth.com, UNEO health.com, to learn more. But we're looking for early adopters and really want to test out, can we make a difference in Cumberland and Charles County and these other areas, and really help close that gap. So I would just say, let me know if you're interested in learning more, and love to talk with you and We just want to see this digital bridge, solve for so many people that are just don't even know what exists out there. And they go to Google, Jonathan. I mean, one of the number one things that came out of our survey is, for youth is when they're looking for help, they just go to Google and see what comes up. They have no idea what's right down the street. So can we solve for that simple piece? And that's our goal here. And Jonathan, definitely want to thank you for your time. I think the rural community just doesn't get enough focus. So I really appreciate MRHA and your leadership and kind of spearheading this type of focus.
Yeah, absolutely. Thank you, for those kind words. It's our goal here at MRHA, to focus on innovative technologies and applications and services that could be beneficial to, our communities that we're looking to represent. And I thank you for your time today to, go over Unio and of course the Prosper app and give our listeners, a great overview of what you could, potentially provide to them and to make our communities healthier. So again, thank you. And what we will do is, of course, when the podcast is launched, in the description on YouTube, there will be a link, of course, to the website that he has available. Of course, your contact information, Eric, will be linked there. And I know that you also had some slides as well. So we'll make sure that slide deck gets released to at least to our newsletter constituents, that they can take a look a little bit more in depth about your product.
Great. Sounds good. Thank you for your time.